By the time I rushed to see the patient collapsed and he had a cardiac arrest. Nearest land is China, which is 3 hours away, like in India. So they told nearest is Calcutta and we can reach in 5.5 hours. Kept the ambulance ready and shifted the patient to the nearest cardiac center. And his artery, LED artery, left anterior descending was 100% occluded. Those who go to the gym or those who do strenuous work, they should be careful to do any strenuous activity during winters. Between 25 to 44, there has been almost 29.9% increase in the fatal heart attacks in the last few years post-COVID.
Welcome to today's podcast on MedSynapse, where we bring you insightful conversation with leading experts in medical field. I'm your host, Dr. Smarika Bhatt, and today we are honored to have renowned medical expert Dr. Deepak Puri with us. He's a Senior Director of Cardiovascular and Thoracic Surgery at Max Hospital, with extensive experience in off-pump coronary artery bypass and ischemic heart failure and minimally invasive cardiac procedures. Dr. Puri is a leader in complex thoracic surgery and vascular anastomosis in liver and kidney transplant. He has served as an invited faculty member at numerous international conferences and authored of 87 publications in prestigious journals. Dr. Puri's international exposure includes visiting surgeon roles at University of Maryland, Swedish Hospital, and Leipzig Heart Center. Dr. Puri continues to make a significant impact in the field of cardiovascular and thoracic surgery. Welcome to today's podcast, Dr. Deepak Puri. We are excited to have you here.
Thank you so much, Dr. Smarika, and it's a great pleasure to be with you today.
Likewise, Doctor. So, to start our podcast with the first question, our first question will be: how does colder weather affect physiological cardiovascular functions, and what specific mechanisms should healthcare professionals monitor in their patients?
Thank you. I'll let you know that what are the effects of cold temperature on normal person and also what is the effect on a heart patient. So I think everybody knows that the cardiac mortalities, they are highest during the winters, and in the period between Christmas to New Year, maximum mortalities occur across the globe, and this continues throughout the January and February month. And in fact, February is also celebrated as the heart month, and various events are organized to make people aware about the preventive aspects of heart complications during winters. So, in the winters, the temperature is cold, so it constricts the arteries throughout our body, including the arteries supplying blood to the heart. And also, there is increase in the viscosity of the platelets. Platelets are cells which clot any tear in the vessel or wherever there is a bleeding. So their role is to form a clot. But in a normal circulation also during winters the stickiness increases, so this can increase the risk of heart attacks also and stroke also. And apart from that, the exposure to sunlight is less, so the vitamin D levels, they go down during winters. And also there are viral infections, and post viral infection, the risk of having a heart attack or heart failure increases. And also cold temperature, it increases the risk of arrhythmias means any change in the rhythm which can cause even death. So the fatal arrhythmias, they are occurring more in winters, especially in those patients who are having heart failure and who have a low ejection fraction, means the pumping of the left ventricle is less. So we have to be very careful, and we have to also keep into consideration that during winters the heart has to work more to maintain the body temperature, because the external temperature is low, but to maintain a body temperature the heart has to pump more vigorously the blood, and the heart rate can also increase, the blood pressure can also increase, so the workload on the heart increases. And also when a person does strenuous activity during winters, then the chances of this precipitating a heart attack are more. So we usually make sure that patients, they don't go out early morning for the morning walks, And also we tell those who go to the gym or those who do strenuous work, they should be careful to do any strenuous activity during winters, especially if they are elderly or if they are cardiac patients. And for the health workers, like it depends on whether we have to first of all make people aware about the adverse effects of winters, and then we have to monitor the patient according to whether the patient is a already diagnosed patient of coronary artery disease, or having blockages in the arteries, or having previous history of any heart attack, or whether they are having any stroke in the past, or if they are having the most neglected part of the complication that people don't consider so much seriously is that during winters, the blockages in the arteries to the legs also, they can worsen, and there can be critical limb ischemia, and the blood supply to the legs and the toes might decrease, and there can be even frank gangrene. So we have to, whenever we have winters, we have to monitor all these things. We have to see the vitals of the person, and we have to see what is their height, weight, BMI, waist circumference, because in winters people they eat more and they do less physical activity, so the chances of gaining weight are also more in the winters. And also the chances of having more fat in the abdomen, that is known as the apple shaped obesity, which is a very uh, accurate indicator of your cardiovascular risk. So it can also increase during the winters. So we have to keep a close watch on that, and we have to, if there's a patient who is having heart failure, then we have to monitor their saturation of oxygen. We can do it with a simple pulse oximeter, and also we have to monitor their various levels of their lipid profile levels, their blood sugar levels, because diabetic patients, they are also more prone to cardiovascular complication during winters. And also we have to at the same time monitor the if the patient is having any symptoms, we have to educate them to report immediately. Like if the patient is having any chest pain, or even a normal person if having chest pain or sweating or any nausea, so all these may be features of onset of a cardiac event. So we have to make the people aware, and if the patient comes with such symptoms, we have to immediately screen the patient for a heart attack, and we do the ECG and we do the troponin test. And also, if the patient is suspected to have a heart failure, then we do the NT-proBNP, and we have to find out whether the patient is going into heart failure, or whether the patient is having an acute onset of heart attack, and we have to treat it immediately.
Okay. Thank you for shedding light on physiological aspect of this disease and various history taking of the patient for healthcare professional. Let's move on to the next question. Which patient population are at higher risk of cardiovascular events during the winters, and how should we tailor preventive strategies for these groups?
One of the age groups, which is the age group which is at highest risk of heart complications during winters, is the elderly population. So anybody who's above the age of say 60 years has more risk of having a cardiac event. And as you grow older and older, the risk keeps on increasing. Both the risk of having a heart attack, the risk of having a stroke, or the risk of having heart failure, or the risk of having peripheral vascular disease, it increases as you grow older. And apart from that, the patients who are diagnosed cases of coronary artery disease with previous history of heart attack, or patient having heart failure, most of the patient of heart failure in India, they become heart failure patient because they come late to the hospital after heart attack, because after 1 hour, which is the golden hour after the onset of any heart attack, the muscle in the heart starts dying, So the more late the person comes, the more chances that the muscle may be dead already on arrival. So we can salvage the patient, but for the rest of the life, the person will become a patient of heart failure. And apart from that, those patients who had a previous history of stroke, so they are also at a high risk. And also those patients who are diabetic, they are also at high risk. Those patients who have a peripheral vascular disease, they are also at more risk. And apart from that, uh, the smokers, those who smoke, they are at an extremely high risk for getting cardiovascular events during the winters. And also, it is seen that those patients who had COVID, so in those patients also, now we are seeing that there is a sudden increase in the fatal heart attacks in young population. So it has been seen that in the age group between 25 to 44, there has been almost 29.9% increase in the fatal heart attacks in the last few years post COVID. And this is much more compared to the fatal heart attacks which occur in the elderly population, which is very alarming. And it has been seen that those people who were hospitalized during COVID because of the complications of COVID, they are more at risk. Their risk is almost 100% more compared to the those patients who were not hospitalized at all. Uh, and those patients who were not hospitalized, their risk is 10 times more compared to those patients who did not have any COVID. So this is also a group of patients who should be careful. And also, we are not only talking about patients, any normal person who has a high family history of cardiovascular events is more at risk of getting the cardiac complication during the winters. And those who are having obesity, especially abdominal obesity, they are also more at risk. And those who do vigorous physical activity without getting any screening done for their cardiac status, they are also more at risk. And those who don't do any physical activity and have a absolutely sedentary lifestyle, they are also having high
At
risk. So
risk.
the risk for physical activity is like a U shaped. Like if you don't do physical activity, your risk is high. You start doing physical activity, it keeps on decreasing, and once a plateau comes, after that, if you do excessive physical activity, then again the risk starts increasing. So you have to have a balanced kind of a physical activity. And those people, like many times in winters, especially during Christmas, New Year, people do a lot of partying. They go travel to mountains, or they go for a vacation, and there's a lot of exertion in the cold temperature. And we find it very commonly that apparently normal person, they go for some vacation, and when they come back they fall ill, or even during vacation they fall ill, and some cardiovascular event is precipitated, because these people, they have a dormant kind of a cardiovascular disease which has not yet become apparent. They are not having symptoms, but when the heart is exposed to extremes of temperature and exertion, and they have less sleep, they party in the night, and the sleep is also compromised. So that produces changes in the body, which can precipitate the event. So we have to be very careful about such activities, and especially people who have binge eating and drinking. So they are also at a risk. During winters, we have a lot of youngsters coming in the emergency from the party. They are just shifted to the emergency, and they are vomiting, thinking that it may be because of the overeating or excess of alcohol. But when we examine them, we find out that they are having a frank heart attack.
Okay. So as you have answered, there is a specific group called if a person have a prehistory of COVID, and if he's, for example, 50 years above, he never had a incident of heart attack, but he has been experienced a COVID fever or have been diagnosed in the previous years that he had a history of COVID, and he's 50 and suddenly he get a chest pain. So how as a patient he'll be able to at home able to diagnose that he is having a chest pain because of a heart attack or maybe a gas related issue or maybe something else chest pain, so he'll be able to diagnose it, or how it will get resolved?
See, I would like to emphasize that most of the people think that only you have a typical kind of a chest pain in the left side of the chest radiating to the
Hmm.
shoulder, then it is a heart attack. But actually that is not true, because most of the patients, they don't have typical chest pain. And also in diabetics, they may have a silent heart attack because of the autonomic neuropathy. They may not have a frank chest pain, and especially in women, they don't have typical symptoms, though they may just feel fatigued, and they may have nausea, they may have a headache. So you have to be very careful. And I would rather say that if a person has any pain or discomfort above the level of umbilicus,
I'm
you
like
should
this.
first try to rule out that it is not because of the heart. So it can be because of cervical problem, or it can be muscular pain, but you should first rule the heart disease out. So many times people think that they are having indigestion, and they treat it as acidity, and they take antacids, and actually it is a heart attack. So last year I was coming from Tokyo after organizing a conference, and one person, he had discomfort, and the air hostess gave him antacids, and the person again complained that he's having discomfort, and again she gave antacid, and then third time when he complained, then it was announced that person is not well, so any doctor on board can see. And when by the time I rushed to see the patient collapsed, and he had a cardiac arrest. So his heart stopped working, his lungs stopped breathing, and then I had to do CPR, and we revived the patient. And then I told the crew that this patient is having a heart attack, and we have to land somewhere. So then they told that we are on the sea, and nearest land is China, which is 3 hours away. So I was not sure whether Chinese they will listen to what I am telling. So I told them that can we go to any place which is uh, like in India. So they told nearest is Calcutta, and we can reach in 5.5 hours. So then I told them that I would opt for Calcutta only. And then we talked to the crew. Then we had to take like permission from the land to land the plane in Kolkata. And then we kept the ambulance ready and shifted the patient to the nearest cardiac center. And his artery, LED artery, left anterior descending, was 100% occluded. So once it was opened, then patient was safe. So it can happen anytime, anywhere. So we have to be aware about it, and we have to know that you should not neglect it. Otherwise, if a person gets a heart attack, and if you neglect, every minute is crucial. Like you're losing several days of your life by
Hmm.
delaying. So
Yes,
this has
yes.
to be people have to be made aware about this, because most of the people, they are not aware about the variability in the presentation of heart attacks and heart failure.
Okay.
Like similarly, like heart failure patient can also present like a person having cough, especially in the night, constantly coughing. So it may be because of heart failure, the lungs getting congested, and the patient is not able to sleep. And many people, they keep on delaying consulting anything. They try their local treatments and
Remedies,
whatever
yeah.
advice, yeah, remedies. So this can actually precipitate. One of my patient recently, like he was operated by me around 15 years back. He had a heart attack, and the pumping of his heart was low. but he had been quite stable and doing his routine activity for the 15 years. uh, he started having this shortness of breath and coughing, and he was not comfortable, not having good sleep. So they just tried to delay for few days, 2 3 days, and then one night early morning they called me up and I told them to come to the hospital. So when they reached the hospital, he collapsed. So luckily he collapsed in the hospital. So we did a CPR for 40 minutes and we were able to revive the patient.
Okay.
And then the patient, like we had to insert a pacemaker along with the defib. So because these patients with low pumping, they have very high risk of having arrhythmias during winters. So many of them, they have a conduction delay also. So they need a pacemaker to pace the heart, and whenever the heart has some arrhythmia, and it can automatically um, like defibrillate, and it can give a shock to the heart so that the arrhythmia is reverted.
That was a great insight of your journey of as a healthcare professional. So let's move on to the next question, which is overlooked topic during the season, that is fluctuating vitamin D. So we would like to address what role does seasonal fluctuation in vitamin D levels play in heart health, and how can clinicians address potential deficiencies in their patients?
This is a very important question you have raised, and over the last few decades, like it has been emphasized that the vitamin D not only has a role in the strengthening of the bones, but it has been seen that those patients who have a low vitamin D level, they are having more risk of having heart attacks and more risk of having fatal heart attacks. And various studies have been done which have shown that vitamin D may be having a role in affecting the immune system. They may be affecting the platelet aggregation, and they may be like if you are exposed to sunlight, then the vitamin D levels go up. And if you're not supposed exposed to good sunlight, then your cholesterol levels keep on going up because of they have a common precursor. So apart from that, like they may be having a role in the endothelial function and the nitric oxide release, which causes dilatation of the arteries, improving the blood flow to the peripheral organs. And also it may be having many other roles which have been under various trials. However, when we talk about the supplementation, the latest studies and various analysis, they have not been able to prove the benefits of giving supplements of vitamin D. So more research needs to be done on this aspect. However, I would like to emphasize that everybody should have adequate exposure to sunlight, and those who use sunscreen. So sunscreen, the effect of sunlight is nullified. So the uh, person, even if they are exposed to sunlight, they are not able to manufacture the vitamin D. And also, like in our food, like the milk products and like mushroom and oats. So they are good source, and those who are taking a non-vegetarian, that they can take cod liver oil and various other things. But the requirement of vitamin D for a newborn baby up to 1 year of age is just 400 international units per day, and for adults it is 600 international units per day to the age of 70. And then above the age of 70, your requirement goes up, so it is 800 international units per day.
Okay. So, in your opinion, how many minutes will be adequate for vitamin D if you're exposed in sunlight? Is there any minute like that, minute or
It
hour?
depends, like you have to see your own vitamin D levels. uh,
Okay.
yeah, so depending on how much deficient they are, so you
Okay.
have to then plan, take medical advice, and then plan and make dietary modifications, because like most of the profession nowadays, we have to go to work early morning before the sun comes out,
Mm-hmm.
and by the time we leave the office, it's already
It's
late night.
gone.
And
Yeah,
yeah,
sun is
so
gone.
when in the routine health checks, it has been seen that even in healthcare professionals, almost 90% they are having low vitamin D levels. And unfortunately, there is no like efforts on the part of the
Oh.
employers to make sure that their employees they get adequate sunlight.
Okay, got it. So it was very insightful how you told how healthcare professionals are also deprived of vitamin D. So we'll move on to our next question. What adjustment should be made to medication regimes for cardiovascular patients who experience seasonal affective disorder or reduce physical activity in winters? As you have addressed before, we would like to have like a medication regime for it.
Yeah, we I would like to divide my answer into two parts. A few things we have to make modification in the medicines, but before that, I would like to tell them about their lifestyle. So the modification in the lifestyle would be that they should totally quit smoking, and apart from that, they should not have a less physical activity, but they can change the time of their physical activity. Like we tell them not to go for a walk early in the morning, but once the
Mhm.
sun is out, they should
Okay.
find time during the day and go for the walk. And especially like when they are going for a walk in the evening, late evening also, that should be avoided. And especially if the weather is bad and there is a strong breeze, then if you have to go out for any reason, then you should have good warm clothes, and you should cover your neck and your ears and your head with a cap. And you should not do like binge drinking during winters. And the eating should be well balanced, because most of the people they take a lot of more food during winters, more fatty food, more sugar, more sweets. Many people they don't balance their lifestyle during the winters. So this is one of the important reason why they land up with complications. So once your lifestyle is controlled, then other medication changes, like these changes I've told, they not only apply for a heart patient, they apply for any normal person
General
also.
population, yeah.
Yeah, but for a heart patient, depending on whether the patient is having a coronary artery disease, then maybe we would like to add some extra drug that would increase the flow of blood to the heart vessels, to the coronaries. And if the person is having a low ejection fraction, then maybe we do more strict intake output monitoring, and we may add some medication so that the patient does not go into heart failure. And rest of the things depend on the reports, like if the patient is having any symptoms, or whether some patient with the heart failure, if they have a higher pro BNP levels, then we try to optimize their guideline directed medical therapy so that they don't land up in the complication. And we educate all the patients that at the slightest symptom, any change in their normal like activities, if they are finding any change, so they should report immediately. They should not self treat, and they should not linger on.
That's a very well put together answer, Doctor.
Hmm.
So we'll move on to our last question. What role does remote monitoring technologies play in managing patients with chronic cardiovascular conditions during the winter seasons? And how a healthcare system prepare for the increased incidence of heart attack?
The first part, I will tell you that we have a wide variety of monitoring now. And first of all, we have to classify, like one is the patient who is admitted in the hospital and the intensive care monitoring is going on. Then we have, like when we send the patient to the step down or to the ward, then we have monitors available for monitoring, and the staff is also there. But once the patient goes home, then we have to be sure that if the patient has been through a critical illness and if we think patient needs monitoring, then monitors are available which can be installed at their home also. And if the patient needs home care, we have to first of all we have a scoring in which we decide whether the patient is fit enough to go home, or he is first to be sent to a rehab. So in a rehab, there'll be constant nursing care also, and there'll be constant monitoring, where the nurse will be doing the monitoring and informing us round the clock. And yeah, now like monitoring systems are available where we can they can even we can log into our mobile phones, and we can see what are the status of the patient. Apart from that, we find WhatsApp very useful, because in WhatsApp you can share all the X-rays reports, all the status, the monitor people, they record a video of the monitor and send it to us. So we can monitor the patient anywhere in the world. So even
Virtually.
our patients who go abroad, like they don't find any difficulty, because they can easily contact us rather than going to the hospital and taking an appointment. Many of them, they just directly contact us, and then we have video counseling and video consultations, in which you can easily book an appointment, and you can call us through a video call also. And various apps are also available, and you can do a WhatsApp video call. And then we have our health apps also, in which you can make a video call. So monitoring depends on like what is the status of the patient. And even now devices are available, like you can patient can have a ECG on his mobile, the 6 lead ECG, and even a 12 lead maybe available to them in the near future on their mobile. And they can simply, and there are like watches also which do some kind of a monitoring, and they can inform us also. And some devices, we insert to the patient, like we insert some CRTD in which the patient is having a wide QRS complex. So if there is a delay in the conduction of the electrical activity to the heart, then we insert a CRTD to the patient if the patient is having a low ejection fraction. So that can even detect whether there's a arrhythmia, and it can itself give a shock to the patient, so that the patient doesn't collapse. And this has reduced the incidence of sudden deaths, because many patients used to suddenly die during winters just because they were having a low ejection fraction, and the risk of arrhythmias was very high. So then we for those patients who don't have a narrow QRS, and but they have a low ejection fraction, and we can insert a ICD to them. So various now technology has advanced a lot, and we have various options available to take care of these patients. And one thing more I would like to add is that there's a lot of pressure on the healthcare during winter, because especially during the festivity season, from Christmas to New Year, and after that, now in India we have Lodi celebrations, and then in the next month there'll be Valentine week. And so a lot of uh, pressure is there on the healthcare workers. And like in some hospitals, they give vacation, the winter vacation to the healthcare, but in corporates there's no such provision. So we most of the load is taken by corporate hospitals during this period, because there may be a deficiency of staff in other hospitals which give vacation to their healthcare workers and doctors. So we have to make sure that our emergencies are adequately manned, and we have round the clock availability of staff, and we have adequate, like we know that already from December to March we'll be having very high input of patients into our emergencies. So we need to be fully equipped for that, and we have to be alert and available round the clock. even on Sundays, even on holidays, even on festivals. So all these things, they can save lives. Otherwise, if a person falls ill and comes to the hospital in the middle of the night, then the cath lab has to be ready immediately. If
Yeah,
the angio has to be done immediately, the cardiac surgery OT has to be kept ready. Uh, so that like if the patient needs urgent surgery, we have to immediately rush to the hospital and
be
do the
prepared.
surgery. Yeah.
Mm.
So this can save a lot of lives if we are fully equipped for it.
Okay, thank you for highlighting remote monitor technologies and measures of preparation. Your insights today were very valuable and covering everything from physiological aspect to cardiological functions to actually preparing of healthcare professional during winter seasons. Thank you once again for sharing your knowledgeable insights with us. It was a pleasure to have you and host you and take a podcast with you.
I would like to emphasize that like you should not take precaution only when you are diagnosed as a heart patient. Everybody should take precaution from the very young age, because nowadays over the years I have seen that in like 2 decades ago, patients in India used to come in their 50s and 60s, and while I was in US and in other countries, like patients usually they are above the age of 65 or 70 when they come for like with cardiac problems. But over the years I've seen that even in India, there has been a drastic increased incidence of cardiac events in youngsters. So
Mm.
otherwise, also genetically, we are prone to had get cardiac events at least 15 years earlier than the Western counterparts. But after COVID, this has become even more less. And nowadays, we are seeing people in their 20s, in their 30s, who suddenly come with the fatal heart attacks. And sometimes, like, they don't even reach the hospital. You should get yourself screened. You should we have devised simple performers to evaluate your risk. So if take just 5-10 minutes to fill it, so it can help you in identifying your own risk, and once you identify your risk, you can prevent yourself from becoming a cardiac patient. So people may not be knowing that 80% of the cardiac mortalities, they are preventable.
Mm.
So we just have to take precautions, and God usually has designed ways to give signals. Like a person gets indication that something is not well, but instead of taking advice from those who are not properly qualified for that, you
Mm.
should take proper advice, medical advice, and then you should take care of your risk factors to prevent such fatal events.
Absolutely, doctor. And thank you to our viewers for tuning in. And remember, if you are a healthcare professional who is eager to delve deeper into our medical topics or have questions, do not hesitate us to join on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you are connected with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution healthcare. So until next time, stay healthy, take care.